We are very proud to have the folks from Medical Associates of Central Virginia here every month to discuss important medical topics, and today is certainly no exception. Dr. Robert Brennan is here, and this time we're discussing another serious issue, and this time we're talking hepatitis C and a dedicated specialty practice right here in the Hill City that I had no idea existed, but that's why you're here. Thank you so much for being on the show.
Thank you, Lisa. Thanks for having me.
So it is the Hepatitis C Treatment Center,
correct.
Is that correct? And
that's
is located at Medical Associates of Central Virginia.
That's
but
correct.
Let's backtrack, because I really had no idea what hepatitis C was until I started kind of researching. So let's teach everybody. What is hepatitis C?
So hepatitis C is a fairly common viral infection of the liver.
Okay.
And we think about 5 million people in the United States are infected with hepatitis C.
5 million.
5 million.
Wow.
And that the majority of them don't know they have it, because usually it's a silent infection. People don't know they get it, and they usually have gotten it many years ago, and they're usually diagnosed because they present with some other problem. So they have an abnormal blood test for liver test, or they get screened for blood donation. Something comes up and they are surprised by this diagnosis of hepatitis.
Okay. Wow, that's interesting. So you were telling me, and I was fascinated by this, there's kind of a certain age range that is known to carry this hepatitis C.
Correct.
Tell us about that.
Sure. So hepatitis C is transmitted by blood products primarily. In the old days, before 1992, we could screen the blood. The blood was contaminated. Doesn't happen anymore.
Okay.
It's not transmitted sexually. It's not transmitted by close contact, but it's transmitted by blood. For example, people who use illicit drugs or recreational drugs. And there was a big population of people who lived in the 1970s and 1980s when they were 18 and 20 years old who did drugs for a very brief period of time.
Wow.
And then did not do it anymore. And when they were infected, they generally were not symptomatic, so they never know what happened. So these people are now in their 50s and 60s, have families, have careers, have no problem until they have a test done and says they have hepatitis C.
So you're basically telling me that it's the baby boomer generation that is pretty much prevalent right now with hepatitis C between 1945 and 1965?
Correct. People who are born in that time period are the most common people to have hepatitis C infection.
Wow. Okay. So definitely, and it is treatable.
It is treatable, correct.
And treatments have advanced in the last couple of years.
And treatment has advanced. That's exactly right. So we've said about 5 million people have it. The concern is that if they have this chronic infection, their liver gets damaged or they develop liver cancer. And we think if that 5 million people go untreated, about 100,000 will die of liver disease.
Wow.
So up till about 2 years ago, there wasn't very good treatment for hepatitis C. It's kind of like HIV back 20 years ago. We didn't have much to offer. Then 2 years ago, they came out with some new drugs that are very effective. It's still not easy treatment. You have to take it for 6 months to a year. But things are changing so quickly that we think within 3 to 5 years there's going to be pills to take that will cure the infection. And the point is, if you are treated for hepatitis C and you are cured, you no longer are at risk for liver disease or death.
And that's where you come in, and that's why Medical Associates of Central Virginia and the Hepatitis C Treatment Center is here, because you're encouraging folks to come, make an appointment, get the test, and you're doing some free screenings, aren't you?
Correct.
For what ages?
Exactly right. So we are screening anyone who's at risk for hepatitis C. That big group is people born between 1945 and 1965, so they can come to our office and be screened for free for hepatitis C.
Free of charge. And then, of course, if anything were found, then you offer treatment options and things like that. Okay.
And Lisa, if I can add, the reason we're doing that is because the CDC about 6 months ago came out and said everyone born between 1945 and 1965 should have a one-time test for hepatitis C in their life. Everybody.
And that's
you and me.
Okay.
Or me, anyway.
All right. You heard it here. So there you go. So then again, Medical Associates of Central Virginia, located at Landover Place here in Lynchburg, 947-3944. Call them and make your appointment now. Central VAMD is the website. Thank you, Dr. Brennan, for the great lesson. Thanks so much.